uh, we don't have a lot of blood, so I can see what I'm doing. So I exsanguinate the blood a little bit, put it like that. So now we're ready for action. First I'm going to free up the nail on the top a little bit. I have to make it look nice, so I don't want to do too much, but I want to do it up to here where it kind of bends down. That's how far we need to do without taking too much, which is going to make the nail look kind of not so pretty, and which is not good. Especially when we have a pretty patient, we want to make sure that the toenail matches their look. So I am freeing that up. As you can see, there are a lot of callus underneath it, so it's kind of hard to free it up. So I have to do it very carefully and methodically so that I'm not hurting the nail bed, which is right underneath this area. As you can see, it's really deep on this corner. So I'm getting down. As you can see, I'm kind of difficult to free in that area up a little bit. As you can see, a lot of callus tissue underneath it. So I'm just freeing that up a little bit more. Wow, this is really deep in there. I finally got it. So we free up underneath that and on top. Free up really good all the way to the bottom. This was really deep. I know it's not infected, but some of these nails are really deep and we don't want to leave anything behind, so we have to free up really well, which is what I just did. Now, I'm use a little nail clipper now to clip the nail right here and then go straight down. We want to make this very straight so that it looks good. Go all the way down to the base of the nail. We have to make sure that we get all the nail in the back, as you can see. And then now we get a little, we call it a hemostat. So take this nail and then all the way down, and then we flip it over like that, and then the whole nail comes out, as you can see. We see a little bit of skin left behind, which we can take this off. It's very important to take the skin off too, because we want to make sure this area is open to drain, because after we remove the nail, it's going to drain out, and we want to make sure that this area is nicely freed up, as you can see. So as you can see, this whole area is very clean. I just make sure again that this is all freed up and nothing is left behind, which I just verified. Nothing's behind, so it looks very good. I put a little bit of antibiotic cream on it, and then I bandage that up. So I put that a little bit right now, and I'm going to put a little band-aid that's non-sticky band-aid. So I'm going to take this tourniquet off.